Welcome, everyone. Thank you for joining us for today's webinar. My name is Lee Montville, and I'm the Director of Special Sales and Business Development at Springer Publishing. For those of you who don't know Springer Publishing, we're an award-winning publisher of nursing and healthcare content featuring books, apps, journals, and digital products, including ExamPrepConnect. Today's webinar, Increasing Nurse Retention, Engagement, and Certification Pass Rates in a Post-Pandemic World, is being presented by Kaiser Permanente, Northern California, and Springer Publishing. Speaking to you from Kaiser Permanente, Northern California are Stacy Hull, Regional Clinical Practice Consultant for KP Practice Excellence, Clinical Education and Effectiveness, graduate of UCSF School of Nursing as a cardiovascular clinical nurse specialist. Luis Perez, consultant for KP Nurse Scholars Academy, has over a decade of healthcare experience and earned a master's degree from the University of San Francisco. Jim D'Alfonso is the Regional Executive Director, Professional Excellence at KP Scholars Academy, graduate and faculty at USF, and Associate Editor, Nursing Administration Quarterly. And Janet Sohail, Regional Director of KP Nurse Scholars Academy, Caritas Coach, and Heart Math Trainer, graduate of USF with her doctorate in nursing practice. Presenting from Springer Publishing is Adrian Brigado, our Vice President, Assessment and Digital Solutions. Before we get started, I wanted to mention that this webinar will be recorded. If you miss any portion of the presentation, you can find the video on Springer Publishing's website 5 to 7 business days post-event. And if you have any questions during the webinar, please type them into the Q&A box on your Zoom control panel. I'll bring them up at the end of the presentation. And if you forget to ask a question, there'll be a brief survey sent at the end of the webinar, and you can include your question there. Now, without further ado, we will turn the time over to Stacy Hull from Kaiser Permanente, Northern California.
Hi, everybody. Can I get the next slide, please? Thank you for introducing our team. We're going to be talking about a CCRN pilot program that we did with Springer Publishing, the Kaiser Permanente Northern California Nurse Scholars Academy, and then the Practice Excellence Clinical Education and Effectiveness Department. So we'll talk about the background, what we did in our pilot and our methods, the results, and also give you some testimonials from our frontline nurses. Next slide. So a little bit of background, as you all probably experienced yourself firsthand, the pandemic was a very unpredictable and scary time for healthcare workers. From 2020 to 2022, nurses were challenged with providing patient care in an unknown, no end in sight pandemic, and it was a very, very grueling time for a lot of nurses especially. This led to a lot of nurse burnout and nurses leaving the profession, and it was a really big strain on our nursing workforce. And it led to really low morale as well. And our pilot specifically looked at the ICU nurses, and that specific nursing workforce really got hit hard with a lot of patients on ventilators and passing away, and there was a lot of burnout from that aspect as well. So the Nurse Scholars Academy from Northern California and the Practice Excellence Clinical Education and Effectiveness Department teamed up to offer a program that invested in these critical care nurses. Next slide. And we're going to hand it over to Luis, who is part of our Nurse Scholars Academy for Northern California.
Thank you, Stacy. Good afternoon, everyone. So just a little bit of context. I think in 2020, the Nurse Scholars Academy launched a national certification campaign to encourage our Northern California nurses to pursue certification. Part of this campaign involved providing certification vouchers to make it easy for nurses to get certified. In terms of Northern California, we represent, or actually, sorry, our nurses are about 23,000 strong, and we represent about a third of Kaiser Permanente's overall nursing workforce. So going back to the certification campaign, even during a challenging time, we launched this campaign and the demand was overwhelming. Like we could see our nurses were really hungry for this opportunity to get certified. And we conducted a survey about in 2021, a year later, and we found that the demand for and the thirst for certification had not subsided. 73% of our non-certified nurses said, yes, we want to get certified. Next slide.
Yeah, this is Jim, and thank you, Luis and Stacy. To give a little context, obviously for the backdrop of COVID, as much as we really are strained and the nurses are really working very hard, we also have multiple other things in motion at the same time. And for us, that was a journey to Magnet and lots of other work that we needed to focus on. We also, like everyone else across the country, are very interested in retaining our talent and helping care for them. As a caring science organization, a WCSI affiliate, Kaiser has been working with Springer on their caring science library, so we had an existing relationship, and we had the opportunity to partner on this pioneer app that they had to support adult CCRN nurses or support the nurses to pursue their adult CCRN certification. So we jumped at that. And at the same time, Stacy was joining our team as a new practice consultant. And it was a great opportunity to really bring the team together to focus on something that nurtured and nourished our nurses. At the same time, was keeping us focused on professional practice, lifting our nurses up, making a statement to the public, as Luis had on his slides. There's obviously an integrity and public image to be presented by certification. So our goals never changed. We just chose to go in a different direction. Really grateful to this team in particular, and Benson Young, who is not able to join us today, but for all their hard work to make this possible during COVID. And I think Stacey's going to talk a little bit about why we think this was so successful, but it was really related to the people connection. So we wanted to give this back to our nurses. It was an investment in them during a difficult time, and we're looking at future ways to go forward, but we had a story to tell, so here we are.
All right, so with everyone involved, we formed a core team within Kaiser. Our pilot champions were myself, Benson Young, my director, who is the regional director of Practice Excellence, Clinical Education, and Effectiveness, Janet Sohal and Jim DeLafonso, who are on this call right now. We helped lead the work, and we recruited some frontline educators and CNSs from the site to help consult on recruitment strategies and how to effectively reach the nurses at the front line. So we had 3 representatives from Kaiser Permanente, Santa Rosa, Walnut Creek, and South Sacramento. And then we also had our Nurse Scholars Academy partners, Ying Tam and Luis Perez, who's on this call, who were tremendous help to us in helping to bridge the 2 teams together. And we worked side by side to provide this resource and certification voucher and online platform to our nurses. And by using the core team to reach out to each of the individual site leads that are the educators and CNSs, we were able to make that personal connection that Jim was talking about that really made our pilot a success. But we'll get to the results. And I don't want to forget our amazing Springer Publishing team. Personally, I've never worked with a better partner that wasn't Kaiser related, and they were just so communicative, so on top of so professional. So I'm very thankful to be able to work with them. And if you choose to partner with them in your education endeavors, you will not regret it. Next slide. So our methods, we met every other week to discuss recruitment strategies and also update on survey results and pilot status. So we made a flyer that went out to all 21 of our Northern California facilities, and each of them all have an ICU. We appointed a point person in the ICU, whether it be a nursing professional development specialist, or our educators or our clinical nurse specialists, to advertise to the front line. And we chose this strategy because each of these leaders knew the staff personally, knew who was certified, knew who wanted to pursue certification, and was able to encourage them. And because of that personal connection, it wasn't someone from an email telling them to sign up. It was that person who has been there in their educational growth, encouraging them to try to achieve this lifelong goal of theirs. And the advertisement did require the nurses to respond to surveys and also commit to taking the CCR exam by October 1st. And we had a month of recruitment. And we recruited a lot more nurses than we expected. We were aiming for less than maybe 175. And we had 230 and actually had to cut off recruitment because we didn't have, the supply wasn't going to be able to meet all the demand. But we were very excited to see 230 nurses enthusiastic about getting certification. Then our next step was to encourage the nurses while they're studying to provide feedback on the exam prep content, and the way it was structured. And it was very valuable to see what they thought was most helpful versus what they thought was more distraction. And what was really great was that Springer actually took that feedback to make their platform better for future users and really valued the input of the frontline nurses using this platform. And then lastly, we did have an end of pilot evaluation that we wanted them to fill out, which they did, and we'll have results for that soon. And then there was a difficulty of getting some of the nurses to actually take the exam because out of the 230, not all of them ended up taking the exam. So we did try to reach out to the directors of education, which is the directors of nursing professional practice, nursing professional development, and then the CNEs of each hospital to help motivate the nurses to take the exam so that they were aware of who was going to take it and maybe needed a little extra encouragement to get across that finish line. And then we did rely on the nurses self-reporting the exam results, but we also had a way through the Nurse Scholars Academy and through the AACN website to look up certification past exam results. Right, next slide. So we sent out the monthly surveys, and then we also reported our results bi-weekly. And in the surveys, we requested feedback on the platform for ExamPrepConnect, also what the nurses actually wanted out of this platform, what their experience was, and if they liked this type of learning. Sometimes it wasn't a fit for every type of learner. As you know, sometimes people are module learners, some people are hands-on learners, some people are more video and graphic learners and visual learners. So we did get their feedback on that. And then also we wanted them to report their exam date and their exam results. Next slide. So our results. This one we were very proud of. And although we did recruit 232 nurses from all 21 hospitals across Northern California, 143 committed to take the exam, saying they verbally committed, but 75 of them actually took the exam and followed through. So the national average for the CCRN, which was reported by AACN, is 71%. Our Kaiser Permanente pass rate was 84%, which is 13% above the national average, which is something we take as a success. Although not all our nurses ended up taking the exam, the fact that we were able to provide a platform that helped them pass was something that was very encouraging to see. And also seeing how many nurses were interested in taking the certification exam was also something that was really eye-opening to see that we just needed to figure out how to get these nurses to take the exam, even though we did provide the study platform and the certification prepaid voucher. More brainstorming and more discussion to come about how to get those other nurses to cross that finish line. And then we actually have our partner, Adrienne, who will speak to how specifically the platform helped with the KP pass rate. So I'll pass it over to Adrienne.
Oh, great. Thank you, Stacy. And actually, Lee, could you go back to the previous slide for a moment? And yes, everyone, my name is Adrienne Brigitto. I'm the Vice President of Assessment and Digital Solutions for Springer Publishing. I worked very closely with the Kaiser team, the full Kaiser team on this pilot. And I just have to say that I echo what Stacy said earlier. It was a tremendously collaborative experience and incredibly rewarding for Springer Publishing. And Kaiser is a wonderful partner. So thank you to everyone. And I'm just going to talk a little bit more about the data that you see here. Like Stacy, we were really pleased with the 84% pass rate compared to the 71% national average. But the pass rates, there's a little bit more there, and the pass rates do actually improve the more study time is spent in ExamPrepConnect. So we did see a direct correlation between number of study hours in ExamPrepConnect and better outcomes. So for example, nurses who spent on average 13 hours of total study time had an 89% pass rate, and those who spent up to 20 hours had a 95% pass rate. And we also know that nurses and in all areas when they're preparing for certification may use additional resources. It's actually very rare that someone would use just one. But we found that nurses who used EPC, ExamPrepConnect, more exclusively or more than other resources that they used also had pass rates that exceeded 95%. So we really do feel that there was our data demonstrated that ExamPrepConnect had a direct impact on exam outcomes. But the positive outcomes extended well beyond just the exam results. And if you'll go to the next slide, you'll see that the vast majority of participants who completed the final survey reported that they felt more empowered and competent in their roles as a nurse delivering safe and quality care after the pilot. So it really had a tremendous impact about how they feel in their role and their competence and their confidence. And they also reported that they were likely to stay at Kaiser due to programs like this that support their professional development. And that's a direct impact of the pilot. But I do want to stress, the pilot was very much about ExamPrepConnect and providing that resource to nurses, but it was about so much more than that, as you've learned thus far. It was about the encouragement and support that was provided to the participants throughout the pilot, and then also celebrating in their success afterwards. As you can see here in this photo, those are pins that were awarded to the newly certified nurses. And Janet's now going to share some additional feedback from the participants on their experiences and the impact it had on them personally.
Thank you, Adrienne. Can we have the next slide, please? So the collaboration with Springer and the support our nurses received from Kaiser Permanente is really shown in these many testimonials that we have received from those that completed the exam prep and took the exam and passed with flying colors. Overall, the testimonials show that this format provided those nurses with confidence and pushed them to do something that perhaps they thought they wouldn't be possible to do for themselves. They loved the ability to grow professionally and how great it felt when they actually passed the exam. And so you can see that enlightenment come out of these testimonials. Next slide, here's some more testimonials of what our nurses are saying. And you can almost feel that excitement and energy come through the written word that's on the slide there when you read these. But there's a lot of appreciation and gratefulness for those that took the exam, and a lot of appreciation and a gratefulness for Kaiser Permanente and this collaboration with Springer. I love this last testimonial on this slide, which summarizes, I think, the essence of what we're trying to say. And it says, the exam prep program by Springer in partnership with Kaiser works. If you are brave enough to run through the rainstorm of a CCRN exam and come out victorious, let ExamPrepConnect be your GPS, flashlight, and raincoat. I think that summarizes the passion and how grateful the participants were with this collaboration with Springer and the support that they received from Kaiser. Next slide, please. So in conclusion, as we continue our journey of nursing excellence and our goal to obtain magnet designation at each of our 21 Northern California facilities. This designation, which is worldwide, is where nurse leaders successfully align their nursing strategic goals to improve the organization's patient outcome, which is ultimately our goal. And so by doing this, the Magnet Program Office has revised and approved health-related professional board certifications. So they have a list, which is on their website. But it's important that being board certified in your specialty not only validates your skills and knowledge, but actually empowers you to perform at a higher level of clinical competency. We are making a mark in moving certification forward in our organization with this collaboration with Springer, and has provided the springboard as we look forward to other certifications as we move forward and hopefully work more with this particular partnership. This is just the beginning. And so we're hoping to do more work and get nurses specializing in other specialties. So our first pilot was with CCRN certification, but we're hoping to move forward with other types of certification that are accredited by the Magnet organization. Thank you. And I think the next, I'll hand it back to you, Lee.
Thank you very much, Stacy, Jim, Luis, Janet, and Adrian for the presentation. That was amazing. Thank you so much for all the amazing words. We do have some questions for our speakers today. So the first question is, one of the greatest concerns today is nurse retention. How did the program impact nurse retention?
I think I can take that, Lee.
Sure.
As a project that its genesis is in the KP Scholars Academy, everything is done around supporting our nurses to be successful and to develop. And, I think the focus of this program is a perfect example of how we support our nurses to make decisions as close to the front line as possible, that they're nurtured along the way with experts and resources and I would say even technology with this example, to shift them out of fear of taking the exam or failure to more around a personal development and a professional aspiration. And in my opinion, it would be the greatest expression of self-care. We really felt that taking the professional certification exam was a wonderful way of nurses to take good care of themselves and celebrate their successes. We also had the opportunity to engage in something that's much bigger than us. So by engaging this, like Stacy said, so many people were willing to step forward to be a part of this pilot. And as she said, we couldn't take them all. We had some limitations. It never limited anybody from going forward with the CCRN, but the pilot itself was limited. So it shows the enthusiasm that is there to realize that you're not only helping kind of test something that's cool and fun and innovative, but you're also doing something to prepare the way for those that are going to follow. If you can help develop a tool that can be put in the hands of nurses that can really help their success rate, you're giving a huge gift to the nurses that are going to follow behind. But the one that really I think is one of our primary goals is to build confidence in people at the same time as we're building competence. Really supports personal agency of our nurses and moves beyond empowerment, which is kind of the greatest retention tool there is, where nurses are really have agency and are acting. And CCRN could not be a better exam to test this on, and to support our nurses. So retention in this day and age is really difficult to measure because there are a lot of things impacting attrition or when people do leave. They may be leaving for all the right reasons, for health, moving, family needs, whatever that could be, or just retirement, early retirement, and just feel that that's the time for them. But for those nurses, when we're bringing in 300 residents, a year now, to retain those residents for the long term, we're really keen on innovative programs and things that really our employees are actively engaged in.
Great. That's that actually another question was related to job satisfaction. So you've certainly touched upon that. What other secrets to success can you share for other hospital systems considering similar certification programs?
Yeah, I can help answer that. So I think the Nurse Scholars Academy offers so many different programs, and I think that just shows the reach and consideration of so many specialties and different level. Like we also, Nurse Scholars Academy targets nurse managers too in terms of leadership, and then our frontline nurses in terms of certification. So having those multiple programs definitely helps. And then having the managers and CNEs and directors of the different departments and services and the education team to form that personal connection is really one of our keys to success and best practices. Making that personal connection with the nurses to show them that there's a whole team supporting them and helping them achieve their goals, whether it be to go into specialty training or to go get another certification. You have a whole health system and all your clinical leaders and education leaders supporting you and cheering you on the whole time. So that I had never seen at any other organization that I worked at, that multiple faceted level of support was really awesome to see at Kaiser, especially first Kaiser in the leadership realm at Region when I started this project.
Excellent, thanks. We have gotten a couple of questions, which Adrian, if I can ask you to answer these, because they're more Springer related. Do you have a exam prep product for FMP certification? And if so, what are the options?
Oh, yes, we do. We have ExamPrepConnect products for all of the major NP certifications, including FMP, and all of the common RN specialty certifications and non-clinical. We have a very broad catalog of ExamPrepConnect products. So our FMP product is very robust. So it contains hundreds of review lessons, thousands of practice questions, 4 practice exams. They also include games to make studying more fun and engaging. There are also discussion boards so that students and users can speak with people who are experiencing the same things that they are. They can share study tips. It's really a robust platform. And so, yes, we do have FMP. If you think about what the certification is, we probably have a product to support it.
Excellent. And another person asked about, oh, sorry, please, Stacy.
I just wanted to add that one of the features that the users really loved is that it's also an app. You can download the app and they could study while they're on the go. And knowing our generation of nurses and having everything on their phone, it made studying so accessible and easy. And they really just didn't have an excuse not to study, because if they're looking at their phone, they could be studying at the same time. So I just wanted to put in a plug for that aspect.
Thanks, Stacy. And also, in addition to that, it is there's a personalized study plan within ExamPrepConnect. So nurses, they would basically enter their target study date, and it provides daily study tasks. It breaks all of the content that's in EPC into daily digestible study tasks for them to complete. It helps to keep them on track. It helps to ease anxiety. It's so much more than an exam prep resource. It's really an all-inclusive study platform. And I'm so glad that your nurses enjoyed it, Stacy.
And Adrian, people also asked, what are the costs? We can certainly follow up with additional information after this webinar to all the attendees and folks that are interested in this. But in terms of the options for some of the products?
Sure. So yes, so there is different pricing because it depends on, if it's an individual customer or if it's an institutional customer. So for example, we work with academic institutions that adopt ExamPrepConnect for their programs. And we offer different access duration options and work with those students and instructors to implement it in their courses. The same is true with hospitals, where we offer different options. And Lee, you could share more about that. But we'd be happy to reach out to you directly to discuss that further.
Yeah, and I can echo that with hospitals, we work with based upon the number of nurses and the engagement or interest in our various products. So I'm more than happy to connect with anybody after this that's interested in learning more. Another kind of technical question, which I'm sure probably varies based upon hospital system and state to state, is somebody asked about, do certified nurses get an increase in pay? I don't know if someone can.
I put that in there because, of course, there's huge variation in that practice. And I'll suffice it to say Kaiser nurses are some of the highest paid nurses in the world. So we don't compensate for every little bit and piece of something that a nurse might do to support their professional development or to support our members, which is really their ultimate goal as Kaiser nurses. What we do is we have a clinical ladder system that recognizes and honors certification. So the clinical ladder system itself will support certification and certainly encourage it. But more importantly, we recognize, celebrate on an annual basis our certified nurses, and there's recognition locally and as well as regionally to make sure they know how important it is to be certified, the benefits of it, and are encouraging and promoting certification because of what it represents to our patients, or what we refer to as our members. So we don't offer a small stipend or something related to certification or recertification, but it is entirely free for our nurses too. So we support not only their initial certification, prep, and other things, we also support their recertification.
Excellent. And I know from other partners that we've worked with, sometimes there are reimbursements, sometimes there are instances where the nurses engage directly with us for that, for access to ExamPrepConnect. I guess
the reimbursement piece, I don't know if the voucher was clear enough to people that might not be familiar with what Luis was sharing, but the voucher system in Kaiser is available to qualified nurses who want a prepaid voucher for ANCC that they can claim for a period of time. So it's active for a period of time. So they can take the exam at their leisure, and they can register on ANCC. There are some parameters around that because you obviously don't want the voucher sitting unused for a long period of time. But the voucher system is a little bit unique. So you don't have to file papers and do a lot of fancy stuff. You make the request for the voucher through the Scholars Academy.
excellent. And Jim, just a follow-up regarding magnet certification. So we know that part of magnet certification and recertification is based upon the 5 key components. To what degree do you feel this certification program contributes to the magnet categories, such as new knowledge and structural empowerment?
Yeah, I think this is someone who's been doing magnet for many years. I would say that this program is in support of all of the pillars of magnet. When you look at transformational leadership and what we're sharing today, there's no better illustration of the process than what Stacy did with her team members and others, which is why the Academy supported it. When you look at structural empowerment, certification is recognized, it's rewarded, it's revered at all levels of the organization. That's an important part, like Stacy said. The support is clear and apparent at all levels. The other one is exemplary professional practice, which I think really speaks to role clarity. The public integrity piece of professional certification and innovation. We said, yeah, it's fun to do different things that are new instead of just the same old process every year. The dynamism of it in complex organizations speaks for itself. New knowledge, innovations, and improvement is lifelong learning. And that is magnet and professional practice, I would say. the commitment to stay on top of things, to join networks, and to become members of professional organizations, both locally, regionally, statewide, or nationally. So the last one is the empirical outcomes, and we shared them with you today. The evidence is there for those people who are looking to create a program like this. Do a pilot, scope it out, take your own results, and use that to support the journey to do future certification programs like this and other specialties to expand your programs. I know that's what we'll be doing.
Thanks very much, and that's a great segue to reiterating to everybody today that thank you again for joining us today. I want to reiterate that we are recording this webinar and that it will be available to everybody within 5 to 7 business days. It will be on Springer Publishing's website, and we will be emailing everybody who has attended today a copy of the recording. As you can see here, if you're interested in learning more, please feel free to reach out to us. springerpub.com/EPC Solutions. Again, if you have any additional questions, please feel free to reach out to us as well. There will be the survey after this. Thank you again to Stacy, Jim, Luis, and Janet, and Adrian for taking the time today to speak with everybody. We are thrilled that everybody joined us. We're thrilled that we have been able to partner with Kaiser Permanente Northern California, and we look forward to sharing that knowledge, the knowledge we've learned from this webinar, with others as well. And please feel free to reach out with any additional questions. Thanks again, everybody, for joining us today. Thank you to our KP colleagues. Thank you again, Adrian. And we wish you a wonderful and happy rest of the day.
Thank you so much.
Thanks so much.
Thank you.
Yeah.
Bye-bye.